welcome back to Great Day. On this Valentine's Day, it is a day associated with love and with hearts. So let's focus on your heart for a moment. How is it doing? I'm excited to have Dr. Mark Gdowski with us today, a board-certified interventional cardiologist at St. Luke's Hospital Heart and Vascular Institute. And Dr. Mark, full disclosure, we're married.
Yes, it's so good to see you on this Valentine's Day at 9 a.m.
I know.
I never get to see you in person at this time.
Well,
so
it's nice to see you in
Yes.
person too. We are here though to talk about heart health specifically. Your focus is aortic stenosis. What is that and what are some of the symptoms?
Yeah. So aortic stenosis is a narrowing of the aortic valve. And so for those that don't know what the aortic valve is, it's the valve that separates the bottom chamber of the heart from the aorta, which pumps blood throughout the rest of our body. Well, when we're young, the aortic valve opens and shuts like a door, so it completely opens and shuts. But as we get older, those leaflets can become calcified. So instead of completely opening and shutting like a door, it only kind of opens up like this. You can imagine when that happens, people can get more short of breath, they get chest pain, then sometimes they can even pass out.
That's pretty scary.
It can be, yes.
Let's talk about then, how is it diagnosed?
Yeah, so if you start to experience some of those symptoms, you really should go to your doctor. And the first thing they'll do is they'll take a history and then they'll listen to you. And what happens when you have aortic stenosis is you start to develop a murmur, which is an extra heart sound that you can hear when you listen to the patient.
Okay, so you have a patient, you have diagnosed him or her with aortic stenosis. What are the treatment options?
So in general, for the longest time, the only treatment option that we had was open heart surgery. So that's when a cardiac surgeon actually goes in, opens up the chest, completely takes out the old valve, and then puts in a new valve. But over about the past decade, we've been doing what's called a transcatheter aortic valve replacement. And what that is, it's a minimally invasive way to actually replace the heart valve. So we put a big tube in the artery in the leg or the artery in the neck, and then we put a wire across the old valve. The new valve sits on that wire. It sits inside your old valve. We open it up. And then you have a new valve that sits inside of your old valve, and it has leaflets that completely open and shut.
And I know personally from experience talking to you over the last few years,
Yes.
you are very highly trained in this TAVR procedure. And I'm guessing a lot of patients would much rather that than getting their chest
Yeah,
cracked
absolutely.
open.
I think the biggest thing, though, is that you have to have a good heart team approach. So when the patient comes to us, they see me as a cardiologist, but they also see the cardiac surgeon. And then we look at everything, and then we ultimately decide what is the best treatment option for them.
It makes sense, Dr. Mark. Thank you for joining us. And if you would like more information on this or how to connect with one of the amazing cardiologists at St. Luke's Heart and Vascular Institute, visit stlukes-stl.com/hearthealth or call the number on your screen, 314-205-6801. Guys?
Pretty sure